Guangxi Lai. He is actually professor of medicine, director of pulmonary and critical care medicine, Guang and Min Hospital, China, Academy of Chinese Medical Scientists, Assistant Professor of Medicine, Pulmonary and Critical Care Medicine, Mayo Clinic, Mayo Epidemiology and Translational Research in the Intensive Care. Dr. Guangxi gonna speak today also about Chinese guideline in the diagnosis, treatment, and management of the COVID-19. I hope Professor Guangxi is ready.
Yes, thanks for introduction. So
Okay.
Here's my slides. So can you see it?
Yes, it's clear, Prof.
Okay, sorry. Oh my God. So today my topic, thank you for giving me the opportunity to be here. So today my topic will be the preventing acute lung injury, the essentials of COVID-19 treatment. So, you know, just as a clinician, what we saw as when we see the COVID-19, the major clinical presentation is fever, cough, and shortness of breath, plus fatigue. Usually it's mild to severe case, and 85% to, you know, maybe it's just mild, and some patients may need some kind of intensive care. They may be around 15, but that's mostly happened in patients with underlying health conditions. But you know, we did see some patients without any, you know, health conditions, and they died. They are pretty young, and they may be pregnant, or they may be just kids. So it's a really horrible disease. And laboratory findings, as we can see, most its white blood cell count is normal or decreased, and the lymphocyte is decreased too. So maybe they have some kind of CPR elevation. And regarding the pathogen findings in our guideline, we usually use nasopharyngeal swabs. Just like a previous speaker, they said the positive rate is not so high. And for the sputum, especially for the lower respiratory tract secretions, that's very important. So we have one patient, we tried 5 times, and finally we used the induced sputum. We did figure out, you know, this patient was, you know, the coronavirus testing positive. So it's really difficult to catch that the sample. So the major thing for this, the mild case is very simple. We just treat it. We just ask patients stay in the hospital very short time. But the only thing is for the severe case, but they do have some kind of early warning indicators we could notice, and then we could do something earlier instead of too late. So the first one is a peripheral blood lymphocyte decrease progressively. And the second one is a peripheral blood inflammatory factors such as IL-6 and you know, CRP increase progressively, lactate increase, and lung lesion develop rapidly in a very short time. So that's what we saw. So, but actually, you know, that's when we encounter the, you know, that's a slice of patients. But what from the patient cohort, what we saw is, you know, incubation period is about 1 to 14 days. Most likely is 3 to 7 days. And the fever period is from day 1 to day 7. That's a very important window. We could do something. We actually, you know, most mild case, they stopped after 1 week. So basically they just come back to the, you know, the normal life. But the severe case, the fever will last for longer than 7 days. So this is a very important golden window to prevent acute lung injury. But once the patients we cannot stop the fever, and the patient may become very, you know, badly dried cough, and plus you know, the fatigue, and plus the shortness of breath. That's what happens in the 2nd week. So that's the patient will fall into the acute lung injury period. So after the acute lung injury, if we can intubate the patients early and the patients recover, then patients go another week. So after 3 weeks, that's a recovery period. So in our guideline, our diagnosis have two parts. One part is a suspect case. So we consider both the following epidemiology history and clinical manifestations. So the epidemiology history is just we do some kind of travel and residence. So it's changing now. So now we are thinking the patient is from some other countries like from Italy, England, like the United States. So that's we are asking patients where are they from. And so if they in contact with the novel coronavirus infected people, and if they have some cluster case, for example, if they have family gathering fever or something like that. So regarding the clinical manifestations, the fever, very important part, and some kind of respiratory symptoms like cough and a sore throat, and the imaging, they have some kind of lung infiltrate or opacity. So it depends on we usually do the CT scan for these patients. They may have normal decreased white blood count, cell count. So suspect case with one of the following etiology or or serology evidence, then we give the confirmed case. So this is the whole picture of the treatment. So right now, I think in the other in terms of our experience, if the patients stay at home, or that's maybe the most mild cases. But sometimes if the temperature we could not control, and the dry cough deteriorate, and they had very severe dyspnea, that's early indicators for the patient's deterioration. Actually, that's a development of acute lung injury. So they need to go to the hospital, and they may go to the emergency room, but this will push a lot of pressure to the healthcare system. So what we need to do is we need to prolong this period so we can reduce the the pressure from the hospital. But even after some emergency room, if we just watch, and the patient may fall into the ICU very quickly, and the patients will develop ARDS. And then we must intubate the patients early, and then we give even if the patients after some intubations they still cannot resolve, and then we need to give ECMO for those patients. So that's what happens for the whole picture of the patients. So that's what we thought is our experience is we need to do something early, because we don't know who will fall into this part. So that's what we need to do. So in the very early stage, just like a previous speaker said, WHO recommendation, we need to do the test, and we need to control the transmission. For the fever window, that's the most important part, because right now we don't have a good drug. So we don't have any antiviral drug that really works. And patients may fall cliff right after fever. The steroids we tried, it did not work very well. NSAIDs, some kind of WHO gives a warning of the NSAIDs use. So, but what we tried really successful is Chinese medicine. So the Chinese medicine, we use that for this pandemic for about 1,000 years. So we had a very good theory and a very good practice on that. So that's the reason what in our guideline we recommended is a Chinese medication. So different combinations and give some herbs to stop the fever. That's what we do. So, but usually the early prevention, we need monitor patients' fever progression closely, and we need to monitor the oxygen saturation very closely. So once they develop ARDS, we use the invasive mechanical ventilation and lung protective ventilation strategy that's similar to the ARDS treatment. And also, if we very importantly, we notice that the prone position greater than 12 hours may really work. So that's rescue therapy. So we did several cases very successfully with a prolonged position ventilation. Regarding the ECMO, it's really uh, uh, very expensive, and the mortality rate is quite high. But if you do have this device, I suggest you could try. But most likely we need to do something early instead of too late. So the early stage, what we thought the most important part is to reduce the fever. So the fever, how we could reduce, and so that's what we tried. This is a family case. So right now I want to share some case what we did. So this family gathering, they had 4 people. They all get the just a second. So here they all get the fever. So you can see they had we did CT scan, and this a fever 2 days. And here they have some kind of bilateral infiltrate, of the lung. And this is a very old man with quite a lot of underlying conditions. But we stopped the fever only in 2 days. And then the patient 4 days later, and they do have very mild infiltrate and some infiltrate gone. So you can see here, so maybe it's not so clear, but we did see some kind of resolution of the CT scan. I don't want to sure, but this patient did not take any antiviral drug. They did not take any antibiotics, and just take some Chinese herb, and they stop the fever gone, and then the patients recover. So so this his wife also has similar things, and we reduce the fever within 2 days, and then the infiltrate also resolved. So this is his son, and this is family case, and he also have very mild infiltrate on the left upper lung. So he has some kind. He don't have the too much symptoms. He just have fatigue and the muscle sore, and they took the same medication in in Chinese medicine. We have very good herb. So and we treated the whole family with only one medication. So that's what we did. So if the fever persistent, so that's an early acute lung injury. So that's another case. So this marathon runner, but he had a lot of medications, and then we can see here the early acute lung injury. After 10 days, we saw this patient, and the fever cannot control, and we just gave the Chinese herb, and we stopped the fever right after 1 day. So so that's a very successful case too. So here is a very a little bit difficult case. He already developed acute lung injury, and you can see on the oxygen saturation on oxygen 65%, and then the oxygen saturation is 81%. So 81%, so it's quite low. And what we did is we used some transdermal therapy with the Chinese herb, and we did see we stopped the coughing. The coughing in this stage is very important. So we cannot control the patient's coughing, then the patient's acute lung injury will progress. So and then finally the patient do not need the intubation, just on the high nasal cannula support. So on the actually, well, you can see the CT scan on the discharge. It's very severe. It's almost 90% of the lung got some kind of infiltrate. So that's 1 month after the discharge. What I just got the CT from him, and then you see most part was resolved, and his actually his saturation go back to the normal. And now after some exercise, his lowest oxygen saturation is 90%. So it's very good. So I think regarding this treatment, mild case I don't want to talk too much, but the severe case we need to pay a lot of attention. So these are the figure from the New England Journal. you could see the memory broken and some kind of the alveolar flooding. That's the most important part of the pathophysiology. So what we need to do is not do something too late. We need to do something early. So if we want to decrease the mortality, we must treat the mild case with a similar, the drug. So that's what we did very successfully in China. So we gather all the patients in some kind of, the how we call that, in the gym or in some, some convention center, and we put the patients and give them all the Chinese medicine, and the patients, nobody develops nobody becomes a severe case. That's what we are going to report this in some kind of I think we are going to submit the paper to the journals, so maybe you could see that. So we need to rest patients on bed in the early ocular injury. We cannot move the patients. So after the ARDS, so right now what we are doing is we are doing the ARDS rehabilitation. So here is a patient, so he got some kind of very severe ocular injury, and that you can see in this is the February 22nd, and this is the March 8th. So you can still see quite a lot of infiltrate and the fibrosis, the nodules, quite severe. So, but we already know this patient already develops ARDS. So what we can do is the patient don't have any fever, certainly. So we just need to ask patient to do some kind of rehabilitation. So after the rehabilitation, the patients did recover, and he go back home, and he's quite happy. So that's what we are doing. So from the early stage to the late recovery, we have a whole team to do, in the different stage. So the take-home message, I think the first thing what we need to do is to do the early prevention. So acute lung injury prevention is the key success to the treatment of the COVID-19. So the major indication for the deterioration is the prolonged fever. So if you cannot control the fever within a week, the patient probably will going to die. So that's what I'm doing remotely for one patient from London. I did see she deteriorated in 1 week. So in the week, I cannot control her fever, and I asked her to go to the emergency room, and she got intubated right after she was in emergency. So I think in every country, the COVID-19 is similar. So we really need to figure out who will fall in the cliff. So the Chinese medicine, I think, is very important. This is a traditional way. So for the new antiviral drug, and vaccination, we still need to wait quite a long time. But the Chinese medicine and some herbs, we use that for 1,000 years, and I think we should consider this as the very first line therapy, especially for the fever and the cough. We do have very good, solution for that. So, and if we cannot control all these symptoms, we need to do something very early. We need to do early intubation, and we need to do early ECMO. So this one we can save a lot of patients' life. Thank you. That's all my talk. Thank you.